Governor Mike Parson promises to help.
Now from the Tri-States news leader in high definition. This is WGEM News at 10.
Well, good evening. I'm Dylan Austin.
And I'm Mackenzie Henderson. People with COVID-19 in Northeast Missouri are heading to the hospital at alarming rates.
That is what Hannibal Regional Hospital administrators told us today as they report that 12 people have died from the virus just since June 1st, and now their ICU is at full capacity.
WGEM's Charity Bell is back from Hannibal and joins us in studio. And Charity, they say all that has staff feeling the weight of the pandemic now more than ever.
Yes, Dylan and Mackenzie, I'm told doctors and nurses are feeling frustrated, broken down, and even defeated at times with how much COVID-19 is surging. They're putting in 70 to 80 work weeks and say everyone has a part to play in getting through this.
Healthcare systems are going to struggle significantly if this does continue in this direction.
Hannibal Regional Hospital Pharmacy and Quality Director Jessica Gilmore says staff are exhausted in this fight against COVID-19, and so are their resources.
They care for these people day in, day out. So much work, so much resources go into it. And then for so many of our patients to end up passing away is an incredible toll on their emotional and mental health.
Gilmore says they're working to double up ICU rooms to fit more critically ill people. She says they're capable of having 2 ventilators in each room, but that adds even more strain and difficulty. Hospitals across the state are dealing with the same issue. That's why Missouri Governor Mike Parson announced a program that aims to help with staffing at overrun hospitals.
To help alleviate this issue, we will be allocating $15 million to contract additional staff.
He says he will allocate $30 million to increase hospital staffing and establish antibody infusion centers across the state. $15 million of that will go towards those antibody infusion centers, which he says have been proven to decrease serious illness from COVID-19. DHSS acting director says that could prevent hospitalizations and death.
Those have to be administered before they would see severe illness.
Another thing that could prevent all that, according to Gilmore, vaccinations. She says she's seen them be successful in the past and is watching them make a difference now.
I think that's the only way that we're going to get out of this.
Gilmore says even you who aren't being treated for COVID-19 could feel the weight of this situation with longer wait times at the hospital. Meanwhile, she encourages all healthcare workers in the region to not give up because the battle isn't behind us and the world needs you. Charity Bell, WGEM News.